Hello everyone, good morning. My name is Preeti D'Souza. Today I am going to talk about mixed methods research design. Hope you had a great session in the morning, introduction to mixed method research design. So I am going to start straight away. The outline of today's topic is as follows. I'll be covering three basic mixed method designs, that is convergent designs, explanatory sequential, and exploratory sequential design. I will be also explaining 7 expanded, advanced and complex mixed method research designs: multistage, intervention, case study, participatory, embedded, intersected and scaffolded designs. And I'll end today's talk by discussing some of the emerging trends in mixed method research design. So let us start straight away. So the first basic design is convergent. Otherwise, it is also called as concurrent, compare, parallel or triangulation designs. I'm sure you are familiar with this type of mixed method design. So the purpose is to obtain different but complementary data about the central phenomenon under study. So qualitative and quantitative data are collected simultaneously. So that is very important. The time point is important. Here it is collected simultaneously and with equal priority. Even that is important because in some designs you will see one type of data is more prominent over the other one. So then emerge results to compare or complement findings. In the more common and technically simpler variation, qualitative and quantitative data collection occurs in parallel, and analysis for integration begins well after the data collection process has proceeded or has been completed. Frequently, the two forms of data are analyzed separately and then merged. So when can we do this? That is really important. To understand both the clinical effectiveness of a program and the patient experience at the same time. For example, what is the impact of a new diabetes education program on patient outcomes and perceptions? So when we can do this, when you want complementary insights, performance metrics, and engagement experiences. Example, how effective is a flipped classroom approach in improving student learning and engagement? The numbers tell what happened, but interviews explain why. For example, how effective is a community recycling campaign? To capture both measurable outcomes and personal experiences in parallel, how does remote work affect employee productivity and well-being? These are some of the examples of when we can do convergent mixed method research design. So the second basic design is explanatory sequential designs. So from the name itself, we can understand what is the design is, like explanatory. So when we need explanations, usually when we have quantitative findings and we need to explain more by using qualitative data. And sequential. So this is taking place one after the other. So explanatory designs are sequential designs with quantitative data collected in the first phase, followed by qualitative data collected in the second phase to explain the quantitative results. So it's very clear, it is explanatory sequential designs. So when can we do this? When you get unexpected or unclear quantitative findings and want to understand why they occurred. So sometimes it happens when we have quantitative findings, we don't know, some unexpected findings or unclear findings we will get. When you want to expand on numerical trends with participants' perspectives, experiences or reasoning. And when you need in-depth insight to interpret or contextualize statistically significant data. So these are some of the situations we can use we can use explanatory sequential design. So examples of explanatory sequential designs in educational research. The first phase, quantitative phase, a school district finds through test scores that students using a new math curriculum perform significantly better. And a qualitative follow-up, data researchers can collect by interviewing students and teachers to understand what aspects of the curriculum helped learning. So this can be applied in nursing education research as well. Healthcare, quantitative phase, a hospital tracks that patient satisfaction drops significantly after surgery in certain departments. And a qualitative follow-up we can do by conducting focus groups with patients to understand their experiences and dissatisfaction sources. More examples of explanatory sequential designs. The example is from workplace or human resource. Quantitative phase, employee surveys show a high turnover rate is correlated with low job satisfaction scores. So we can do a qualitative follow-up interview with departing employees to explore reasons behind dissatisfaction. So another example from public policy, quantitative phase, a city survey finds residents in low-income neighborhoods are less likely to use public parks. Qualitative follow-up, community focus groups are held to explore barriers such as safety concerns or lack of facilities. So the third basic design is exploratory sequential designs. So when we need to explore, so exploratory and what type of data? Usually in exploration we use qualitative data. So exploratory designs are also sequential, mixed method designs, but qualitative data are collected in the first phase to explore and generate hypotheses. Followed by quantitative data is used to test these insights. The design has its central premise, the need for initial in-depth exploration of a phenomenon. Findings from the initial phase are then used in a second quantitative phase. So you can imagine when we need to explore. When we can do this, when we need to explore or use exploratory sequential mixed method designs. When a phenomena is not well understood, there is little existing theory or empirical research. When you need to develop a measurement tool or intervention, when you are not sure what to ask or what intervention or what content to be incorporated, it is better to start with a qualitative data collection. When you want to explore participants' views first, before creating a survey or testing a model, explore lived experiences to inform what to measure. Generating and testing hypotheses, use early qualitative insights to form testable hypotheses. More examples of exploratory sequential designs related to patient experience. Here the qualitative phase is first. We can conduct interviews with patients to explore their experiences with chronic pain management. Followed by quantitative phase, use the themes to create a survey and test how widespread certain concerns or barriers are in a larger population. Curriculum development scenario, qualitative phase, focus groups with teachers and students to explore challenges in teaching critical thinking. And quantitative phase, we can develop and administer a questionnaire to assess the frequency and perceived success of critical thinking strategies across schools. More examples, understanding coping strategies, qualitative phase, in-depth interviews with people experiencing anxiety to explore coping mechanism. And what we can do in quantitative phase, we can test how common those mechanisms are and their correlations with well-being scores using standardized instruments. One more example, vaccine hesitancy topic. Qualitative phase, explore reasons behind vaccine hesitancy through focus groups. And quantitative phase, survey a broader population to see how prevalent each reason is and which demographic groups they affect most. So that is the end of the first part. That's 3 basic designs. The first one is convergent, explanatory sequential, and exploratory sequential. Now we start with expanded or advanced or complex designs. So you can see this type of framework or designs, they use the basic designs but in a more advanced or complex way. So more sophisticated frameworks that build on core designs are increasingly discussed in this type of advanced designs. Advanced frameworks encompass adding to one of the three basic designs a larger framework that incorporates the basic design. So let us start. The first one is Multistage Mixed Methods Framework. So the name itself, we can get an idea of what it is. So it is conducted in multi-stage, and each stage there is a mixed method approach is employed. In a multi-stage mixed methods framework, researchers use multiple stages of data collection that may include various combinations of exploratory sequential, explanatory sequential, and convergent approaches. So multi-stage and multi-phase. I came across another terminology called multi-phase. Is it the same? Because in mixed method research also there are several terminology used, and we need to be clear and clarify what it is. So while both involve multiple stages or phases, multi-stage mixed methods and multi-phase are distinct concepts. So what is multi-stage? Multi-stage mixed method refers to a specific type of mixed method research where different methods are used sequentially or concurrently in multiple stages, often iteratively, to build upon each other. So what is multi-phase? On the other hand, can refer to a broader concept of conducting multiple studies or phases within a larger research program, potentially with or without mixing methods. So in multi-phase research, it's not mandatory to have mixed methods approach. It consists of multiple studies or phases. Okay, coming back to multi-stage mixed method research, when can we do this? The study has multiple data collection points across time. Different methodological approaches are used at different stages, qualitative, quantitative, integration, or any combination. Usually the study is longitudinal, iterative, or involves multiple research questions that require varied methods. When you are dealing with complex phenomena that cannot be adequately understood using a single mixed method design. So when can we do this multi-stage mixed method research designs? This type of framework may be used in longitudinal studies focused on evaluating the design, implementation, and assessment of a program or intervention. So I was part of a multi-stage mixed method research design conducted at UCL. So the multi-stage mixed method study to develop and test in a randomized controlled trial a website to help users choose contraception methods. So we had 3 stages. In the first stage, we used a convergent design using focus group and a survey to find out what type of contraception methods are used in the population and what type of website, the features, the content, and to get an idea about how to do the implementation part of it. So the second stage, we tested the website in a randomized controlled trial to assess its effectiveness and collected qualitative data to understand user experiences. And the third stage, because it was a long-term longitudinal study, the third stage was like a follow-up data. We used both quantitative and qualitative data to determine the usefulness once the website is rolled out in the real world. So this is how the multi-stage mixed method research design is carried out. Okay, more examples. Public health program evaluation, 3 stages: exploratory, convergent, explanatory. Stage 1 is exploratory sequential. Conduct focus groups, exploratory sequential. The qualitative research is first. So conduct focus group with community members to understand barriers to vaccination and implement survey design. In stage 2, convergent design is employed. Simultaneously collect survey data on vaccine hesitancy and analyze interview transcripts to validate and expand on quantitative patterns. And stage 3 explanatory, sequential. So here quantitative data has to come first. So use statistical modeling to test hypotheses informed by qualitative themes followed by expert interviews to interpret unexpected results. So this qualifies as a multi-stage framework because it has 3 stages with a mix of different types of mixed method, simple mixed method research design. So the second complex design is intervention mixed methods framework. You will see some similarity with the multi-stage design, but here the focus is on intervention. So in an intervention mixed method framework, the focus is on conducting a mixed methods intervention. So that is the title goes like intervention mixed method. So the focus is to conduct a mixed methods intervention. So qualitative data are collected primarily to support the development of the intervention, to understand contextual factors during the intervention that could affect the outcome and explain results after the intervention is completed. So qualitative data also is used at different stages before, during, after. Sometimes sometimes it can be only used before the implementation or before the intervention, or during or after. Sometimes it can be used in all stages. So in an intervention mixed method framework, qualitative data plays a critical role before, during, and after the intervention. So below are practical examples and situations that illustrate when and how you can apply this approach effectively. So the difference is in multi-stage, each stage we are having a mixed method type of data collection. But here some stages can be only qualitative. Then you can have the intervention, evaluate the outcome. You can collect process evaluation data again using qualitative methods, and also after the implementation also you can use qualitative methods. It is not necessarily like each stage you need to have mixed methods. So that is the main difference between multi-stage and intervention mixed method framework. So when can we do this? In this example, data from a pre-trial qualitative study was used to inform the design of a trial developed to compare a low dose and high dose behavioral intervention to improve cancer pain management. The trial also included prospective qualitative data collection during the trial. There is also quantitative outcome evaluation. So I would like to give 3 specific examples of intervention mixed method design. One is before the intervention, when how it can be used to development and designing of the intervention. The purpose is using qualitative data to inform the development of the intervention. And the example is the context: you are designing a health promotion program to increase physical activity among adolescents. So the action: conduct focus group with teens to understand their barriers and motivation regarding physical activity. Outcome is insights: help tailor the intervention to make it culturally and contextually appropriate. So you can see the difference between multi-stage and this type of design. So during the intervention, understanding the contextual factors. Use qualitative data to monitor implementation and understand how context affects the intervention. This is some sort of a process evaluation data. So practical example, a job training program is rolled out in 2 different communities. So this is already the program is implemented. Now we are thinking of what type of data will be useful. Conduct interviews with participants and facilitators and during the program to explore how location-specific factors or context, for example, transportation access, local job markets impact participation. The outcome reveals that in one site, lack of childcare reduces attendance, leading to a mid-course adjustment offering on-site childcare. So this is used in making adjustments to the interventions. This is like a mid-evaluation so that we can make some changes. The context is an educational technology intervention aimed to improve math performance, shows mixed quantitative results. Conduct interviews with teachers and students post-intervention, and in outcome findings reveal that students with high improvement had more access to tech at home, while others struggled with usability, helping to explain the variation in outcomes. So now the third design is case study framework. So in intervention design, the focus is on intervention. So you can do before, during or after, or you can do at certain phases also. So case study framework, here the focus is on a case. So when you think of a case study, like in medical background and nursing background, we think of a patient or fewer group of patients like that. But here the case study is used like an organization or evaluating a large program, etc. In a case study framework, both qualitative and quantitative data are collected to build a comprehensive understanding of a case. So the case is the focus of the study, and to have a comprehensive understanding, we need to have qualitative and quantitative data. Case study involves intensive and detailed qualitative and quantitative data collection about the case. The types of qualitative and quantitative data collected are chosen based on the nature of the case, feasibility issues, and the research question. So this is an example of a project which I was involved. In fact, it is an ongoing project. So navigating complexity, we use a case study type of mixed method research. So this was the research question is to explore potential benefits and challenges of science policy institutions for evidence-informed policy making in education, a case study of a particular country context. Here it was Thailand. So the case here is the science policy institutions in Thailand. That is like evidence-informed policy making in education. So what is their role and what is the potential and benefits and challenges of these institutions for evidence-informed policy making in education. So we use both quantitative and qualitative research to explore how organizational frameworks, stakeholder dynamics, and systemic influences shape EIPM processes, adoption, implementation, and institutionalization. So you can see it is a very complex type of case, and we can employ case study mixed method research design here. So when can we do this? From the example itself, to explore complex phenomena. When a case is complex and multidimensional, example, a school reform effort, a hospital's response to a pandemic, we can combine qualitative and quantitative data, gives a more complete picture. To answer how and why questions alongside what or how many. So you can see a various range of questions can be asked here. Qualitative data helps explore the how and why, while quantitative data answers how much, how often, what is the impact. When stakeholders require both evidence and context, policymakers or practitioners may need measurable results, quantitative along with narrative context or user experience to inform decisions. When feasible, feasibility is very important. When you have access to both types of data and the resources, it is time, money, expertise, all required to collect and analyze them. All type of advanced mixed method research design is resource intense. Example, some case study approach, education case study, like evaluating an innovative teaching method, qualitative, we can have classroom observations, multiple qualitative methodology, classroom observations, teacher and student interviews, analysis of teaching materials. And in quantitative, student test scores, before and after intervention, survey data on student engagement, etc. Healthcare case study, implementation of telemedicine, here qualitative data from interviews with patients and providers, field notes from consultations, and quantitative data usage statistics, patient recovery rates, satisfaction survey ratings. Business case study, we can use startup growth strategy, and in environmental policy case study, we can use this case study framework. Moving on to the fourth design, advanced design, that is participatory framework. So the title explains participatory frameworks. That's how it focuses on participation. So participation of whom? The study subjects or the participants. So This is not done in a regular participants, type of participants. It is usually done for special groups where their participation is the main focus and the priority. So in a participatory framework, the focus is on involving the voices of the targeted population in the research to inform the direction of the research. Often researchers specifically seek to address inequity, health disparities, or a social injustice through empowering marginalized or underrepresented populations. The distinguishing feature of a participatory framework is the strong emphasis on using mixed method data collection through combinations of basic mixed method designs or even another advanced design, for example, an intervention framework such as an RCT. So when to use a participatory framework? Here you have to remember the participation of the participants or subject is the core or the most important element. So, and the participants are usually special or vulnerable group. To address health disparities or inequity, you are researching chronic disease prevalence in underserved communities, working with a Native American tribe or any tribal group to co-develop and evaluate diabetes prevention strategies. To empower marginalized group, when you want to understand barriers to mental health services among LGBTQ plus youth, an example is LGBTQ plus youth co-design survey instruments and help interpret findings. To improve community trust and relevance of intervention, so this is done in a historically mistrustful population to improve the trust and confidence. To ensure cultural relevance and acceptance, you are developing educational materials for immigrant populations, and community elders and leaders can help design language appropriate and culturally respectful health promotion content. So when can we do this? An example is from community-based participatory research project, mixed method CBPR approach to collaborate with the Somali community to explore how attitudes, perceptions and cultural experiences such as female genital cutting influence their use of reproductive health services. This informed the development of interventional programs to improve culturally competent care. So examples using mixed methods in a participatory framework, basic mixed method designs like Convergent or Explanatory sequential. Example, quantitative collect survey data on food insecurity in a Latino community, qualitative contact focus groups with families to understand experiences and barriers. Community members help interpret data and shape policy recommendations. Mixed method plus intervention advanced design like RCT. Example, use a randomized control trial to test a school-based anti-bullying program. Include participatory components like students help design the intervention, teachers co-facilitate the delivery, and community stakeholders assist in interpreting RCT results and scaling the program. So you can see here participation is given importance and mixed methodology is used, basic designs are used, and sometimes advanced designs also are used. And the key is participation, and it is also done in vulnerable group or special group of participants. We have done this type of participatory framework for our research on migrant populations and refugees in our unit. Okay, moving on to the fifth type of advanced design, that is embedded design. So there is the key difference here between other type of designs. Here also we have qualitative, quantitative, but the key difference is here one design is dominant and the other type of design is in a supportive role or embedded within the dominant design. So it's not like both the designs are given equal priority. So that is the key difference. So one method, either qual or quant, is nested within a larger study dominated by the other method. So one type of data is used in a supportive capacity in a study based primarily on other type of data. Either qualitative or quantitative data can be dominant, although in most embedded design, qualitative is supportive of quantitative data. So the difference between exploratory sequential design or explanatory sequential design and embedded design is the sequential designs, exploratory and explanatory, involves, like here exploratory involves starting with qualitative data collection and analysis to explore a topic, then using those findings to inform and guide subsequent quantitative data collection. So here both the type of data, they are given equal importance. So that is exploratory. In explanatory, it is the other way. Quantitative is used first and then qualitative. Again, both the data given equal importance. In embedded design, on the other hand, integrates one type of data, qualitative or quantitative, as a supplemental component within a larger study primarily focused on the other data type. That is what embedded. Embedding is something within a bigger framework. Embedded. So that is the meaning. What can we do this? When can we do this? Embedded designs. Using this design when you have a primary method. So you are largely driven by either quant or qual. Your research question is largely driven by quant or qual, and you need some supplementary data to provide additional insight, explanation or context, some support. The study context is complex, such as in clinical trials, program evaluation or education interventions. You are testing an intervention and want to understand both outcomes and participant experiences. So let us see some practical examples of embedded mixed method design. So in health sciences clinical trial, the primary method, quantitative RCT, measuring the effectiveness of a new medication on blood pressure. An embedded method is here qualitative, interviews with participants to understand their experiences with side effects or adherence to medication. And the purpose of embedding? The qualitative data explains why some participants may not respond as expected, adding context to the quantitative results. The second example is from a program evaluation in education. Primary method is quantitative again, pre and post test scores to evaluate the effectiveness of a new teaching method. Embedded here is qualitative, classroom observation and teacher interviews during the intervention. And the purpose of embedding is qualitative data helps explain how the teaching method was implemented and perceived, supporting the quantitative findings. The third example is unique. Here the qualitative data is primary, and the example is from education technology integration, case study of how a school integrates a new educational app. Embedded method here is quantitative, usage data from the app like logins, time spent, number of tasks completed. The purpose of embedding is quantitative data supports the qual findings by quantifying student engagement. So these are some of the examples of embedded mixed methods design. So we have completed the 5 advanced mixed method designs, and because why I am telling we have completed 5 designs, because the next 2 designs, that is intersected design and scaffolded design, it is not just the data collection here is just qualitative, quantitative, or the integration is like a mixed method. This is much more broader and more philosophical. So the intersected design, the intersection is in various levels. So all the previous advanced designs, you can see the intersection is, the mixed method aspect is mainly in data collection, but they involve multiple methods in a different way with a different focus. So here the situation is little more advanced, because in intersected designs we can visualize paradigms, theories and methodologies as vectors intersecting, ideal for studies integrating diverse philosophical orientation. So here multiple philosophical orientation, multiple theories, multiple paradigms are tested in this type of designs. So it is not that common. You will find very few examples in the literature because it is very difficult to implement. I'm just giving some explanation of these 2 design for the completion's sake of today's lecture. So the intersected design, advocated as terminology by Plano, Clark and Ivankova, they draw on the notion that the different dimensions of philosophical orientation, paradigms and theories are like vectors that intersect. A researcher using, so here mixed method, that all the core designs and some of the advanced design, the features are used. In addition, different philosophical paradigms, theoretical orientations, all that is used here. A researcher using survey methodology, mixed data observations and grounded theory in a qualitatively oriented study could represent their research through the intersection of these vectors. An advantage of the intersected rhetoric is that it allows any combination of philosophical, theoretical, analytical lens and methodological approaches. So when can we use intersected mixed method design? It can be used when multiple paradigms are needed to understand the phenomenon. It is not just multiple data is needed, you need more beyond that, multiple paradigms. Combining post-positivist rigor in measurement with constructivist depth in understanding lived experience. When we need different theories, often complementary explanation, combining self-determination theory with critical race theory in education research. When we need methodological flexibility, employing grounded theory inductively while also using surveys for generalizability. When researcher intent is integrative rather than sequential or parallel, it is not just running quantitative, then qualitative or vice versa, but synthesizing them at the level of paradigm and theory. So that is the difference. Examples of intersected mixed method design. Example 1 from education. Paradigm vectors are post-positivism for measuring achievement, constructivism for exploring student perception. So post-positivism is mainly a quantitative paradigm. Constructivism is for exploring student perception, but this is beyond data. It is the paradigm or the philosophical understanding. Theoretical vectors, self-efficacy theory plus socio-cultural theory, and methodological vectors, quantitative and qualitative interviews, and design intersection. So in other design, it is mainly the methodological type of integration, but here the theoretical and paradigm vectors are used. Design intersection, the study doesn't just compare or follow up, it blends methods and philosophies to produce a composite understanding. The second example is from public health research. Paradigm vectors, again pragmatism, problem solving, transformative emphasis on equity. Theoretical vectors, health belief model plus intersectionality theory here. Methodological vectors, GIS mapping, focus groups and policy analysis. Design intersection, interweaving spatial, personal and systemic data to understand vaccine hesitancy. That is the topic used in this example. The third example is organizational behavioral study. Paradigm vectors are critical theory, power structures, post-positivism, employee productivity metrics. Theoretical vectors here are motivation theory and organizational justice, and methodological vectors, surveys, ethnography and document analysis. Design intersection examines how structural inequality shapes employee motivation, blending macro and micro perspective. So the next design is scaffolded design. So this is another most advanced design, and it is a relatively newer one. The scaffolded design categorization by Fetters 2020 indicates that there are many dimensions, levels or scaffolds in mixed method studies, and that researchers can build together any number of scaffolds to reflect these dimensions or levels. So this is somewhat similar to the intersected design. You can see scaffolded are like supporting structures, like we are breaking the complex phenomena into multiple smaller levels and supporting structures. Scaffolding, that is scaffolded design, represent research approaches that collect both qualitative and quantitative data, are built with a core design or combination of core designs and explicitly integrated with another core design methodology, theory, paradigm or philosophical position. So scaffolded design, core mixed method designs like Convergent, Explanatory, sequential or Exploratory sequential is used. Explicit integration not just of data but with theory, paradigm, methodology or philosophical position. Three-dimensional structuring here where layers or scaffolds represent different foundational elements. So difference between terminologies, like little bit we have seen the intersected design and scaffolding and multistage. So in mixed method research, scaffolding focuses on structuring a complex task into smaller manageable steps with support. Multistage involves sequential data collection and analysis in distinct phases, and intersected, the previous design, integrates different methodological approaches of or theoretical frameworks to strengthen the research design and interpretation. So when can we use scaffolded mixed method design? So they are most appropriate when the research problem is complex and demands multiple lenses or dimensions. The study aims for deep integration of methods beyond simple sequential or concurrent timing. The research seeks to explicitly align data collection and analysis method with theoretical frameworks or paradigms. This is also similar to intersected design. The study includes multiple core design, both exploratory, sequential, and convergent, and needs a way to map their integration clearly. There is a need to bridge interdisciplinary paradigms, example integrating psychological and sociological theories in health research. So practical examples of scaffolded mixed method design: health behavior study using pragmatism and critical realism. So here the terminology is different, the methodology. There in intersected you can see the methodology is explained differently, though there are some similarities. So here we have to explain clearly what is the scaffold 1, scaffold 2, scaffold 3, something like a multistage. So explanatory sequential design is in scaffold 1. So you know explanatory sequential start with a quantitative survey on smoking behavior and follow up data with qualitative interviews to explain anomalies in the data. And scaffold 2 is a philosophical position combining pragmatism for method choice and critical realism to interpret observed versus real mechanism. And scaffold 3 is theory integration, integrates health belief model and social practice theory to interpret findings. The second example is from education research and online learning efficacy. Scaffold 1, convergent core design, collects student performance data and context focus groups with instructors simultaneously. Scaffold 2, methodological core, includes cognitive load theory as a quantitative scaffold and phenomenology for the qualitative strand. And scaffold 3, paradigm alignment, aligns post-positivist assumption. Example, test scores are proxies for learning with constructivist approach students' lived experience of virtual environment. The third example is from public health policy evaluation. Scaffold 1 is a multi-phase mixed methods core design, repeated cycles of quantitative, qualitative data over time. Scaffold 2 is policy implementation framework, uses the consolidated framework for implementation research to scaffold analysis. And scaffold 3 is methodological scaffolding, embeds case study methodology for each policy site, integrating realist evaluation. So as you can see, this is a very complex form of mixed method research design. So we have completed the 7 advanced mixed method research design: multistage, intervention, case study, participatory, embedded, intersected, and scaffolded designs. So emerging trends in mixed method research reflect both the evolution of research methodologies and the growing complexity of the questions being explored across disciplines. So some of the key emerging trends in mixed method research. So greater integration of qualitative and quantitative data. So if we look at the mixed method studies, we can see most of the studies it is only a superficial integration of quantitative and qualitative data. So there is a push for greater integration rather than just presenting side-by-side presentation to genuine integration in data analysis and interpretation. You need a lot of thoughtful process here while developing the research question, purpose of mixed methods and purpose of integration, all that. You need a very in-depth process to do that genuine integration. Next is, you can imagine, you can guess this, like use of artificial intelligence and machine learning, leveraging AI and ML for data analysis, especially in large data sets, automating coding in qualitative research using machine learning models, etc. Digital and online research environments. Lot of digital research is conducted using digital media and online. Increased use of online tools and platforms for data collection. Mixed method research using interviews like online interviews and survey platform, etc. The fourth is global and cross-cultural mixed method. So MMR is being adopted in non-Western contexts, especially in low-middle income country with cultural adaptations, research integrating indigenous knowledge systems and Western scientific methods. And then the fourth is iterative and adaptive design, emphasis on flexibility, non-linear designs and creativity that adapt to findings in real time. Participatory and transformative approaches, engaging more of participants, stakeholders, community more directly in both design and interpretation. Advanced visualization techniques, new forms of data visualization to represent mixed method research findings. Institutional and methodological standardization for the development of clearer reporting standards. Focus on ethical integration and hybrid theoretical framework using mixed method theoretical lens to guide different components. So these are some of the trends in the field of mixed method research design. It is an emerging field and lot of methodological development is taking place, and other type of development also will influence the development of newer models in this mixed method research design paradigm. So I have used a lot of reference to prepare this talk and to learn different mixed method research design examples and all that. So I have only given some few key references at the end of this presentation in these slides you can see. So hope this presentation is useful and it will inspire you to undertake some mixed method research, and also those who are doing mixed method, it will help you to think of more advanced frameworks and more creative frameworks. So I will see you all soon around 12:30 your time if you have any questions to discuss. So thank you once again for listening to this presentation. Goodbye.